Good evening, everyone. A very warm welcome to all. I'm Dr. Muskan Ahlawat from Voice of Healthcare, and I'm delighted to host today's session on understanding the silent threat, liver cancer awareness, organized by Voice of Healthcare in collaboration with Isai Pharmaceuticals. Our theme today, from silent damage to hopeful recovery, focuses on understanding how liver cancer silently progress over time and how timely awareness, early detection, and innovation in treatment can truly change patient outcomes. Before we begin, let's take a moment to understand why liver cancer deserves our attention. So, liver cancer is one of the fastest growing cancers worldwide, and it often goes undetected until it is at advanced stage. In many cases, the liver suffers silent damage due to some conditions like hepatitis B or hepatitis C, alcohol overuse, or fatty liver disease. All of these can progress quietly without any major symptoms. That's why awareness, early detection, and preventive measures are absolutely crucial. And today's session aims to bring that knowledge gap between medical science and public understanding. To help us understand this better, we are honored to have Dr. Bharath Rangarajan, Senior Consultant in Medical Oncology at GEM Hospital, Coimbatore. Sir has extensive experience in treating cancers and has been instrumental in promoting evidence based and compassionate oncology care. Welcome, Dr. Bharath.
Welcome. Thank you for the welcome and the nice introduction.
Yes, sir. So, sir, starting with, can you help us understand what exactly is liver cancer and what are some early warning signs that people should look out for?
Uh, Great. So, firstly, let me thank the Voice of Health team for having me today for this discussion. It's great to be a part of liver cancer discussion because October is basically also the liver cancer month. uh, October, everybody knows, is celebrated as Pinktober and Pink October, and it's very famous as a breast cancer month. But October also is a month that we have allocated for liver cancer. So it's really good that we're not um, we are not putting our attention all onto breast cancer, and we're also discussing the other major cancer which should be remembered this month, that is the liver cancer. Now, coming to your question of what are the early symptoms of what is liver cancer and what are the early symptoms. Cancer per se is a disease that can affect any part of the body. I think everybody knows, from brain to bone to skin to lungs to breast, uterus, gallbladder, pancreas, liver, any other part of the body can be affected by cancer. So, what is cancer basically? Cancer basically means that our body has so many normal cells, but what happens when these normal cells suddenly develop an abnormality? These abnormalities are usually cleared by our own immune systems. So I'll tell you why this is important in later part of our talk, this immune system. But our body has many mechanisms to ensure that all the cells in our body remain normal and they don't actually become abnormal. But unfortunately, with age and many other reasons, due to many other reasons, abnormal cells do start forming in our body. Now, these abnormal cells sometimes develop some very major differences from normal cells. The major differences are they grow very fast, they form lumps, tumors, they don't function in any organ like a lung. The cells in a lung, what are they supposed to do? They are supposed to handle the oxygen, they're supposed to take in the oxygen and let us breathe out the carbon dioxide. Liver has a lot of functions, but the one of the main function is to produce secretions like bile and enzymes for the digestion of food. Another function is a storage function where it stores glucogen and other fats for use in the body at later times. It has got synthetic function. It produces many things that are needed, like, clotting factors. Many proteins are produced in the liver. So these cells have a certain function. So whenever a cancer develops, these abnormal cells firstly lose their function. They don't do the function that a normal liver cell should do. They are abnormal, they lose their function. The second thing is, normal cells have a lifespan. They live for some time and then they die out a natural death, and there are other cells to replace these normal cells. But these abnormal cells, they have got a much longer lifespan than a normal cell, and they keep growing and multiplying and growing and multiplying, which is the third thing. So these cells, cancer cells or the abnormal cells, keep multiplying. They grow very fast, and that's why they form these tumors. So
Mhm.
abnormal cells have all these factors. That is, they don't do what the normal cell should do. They grow very fast. They keep growing and outlive, the normal cells, and they continue to live longer. They escape from the immune mechanism where the abnormal cells are supposed to be killed by the immune mechanism or removed from the body by the immune. So liver cancer, you asked me what is liver cancer. So liver cancer basically is a set of these sort of abnormal cells that are growing in the liver, that have no business growing in the liver like that. And when you talk of liver cancer, we generally, use the word cancer in a loose fashion. But cancer is not a diagnosis, it's not a single diagnosis. For example, to put it simply, when you say diabetes mellitus, that is our usual common diabetes, or hypertension or blood pressure, it is a disease, right? And you get it. But cancer, unfortunately, is not like that. In liver itself, the cells could be abnormal in many different ways. So in liver, the common type of cancer is called a hepatocellular carcinoma, that is a HCC. But the liver can also have another type of carcinoma which arise from the bile duct and the biliary radicals, called the cholangiocarcinoma. In addition, there could be many, many rare tumors. So when we say what is liver cancer, one is, it's a growing mass of abnormal cells. That is one way to look at it. But these growing mass of abnormal cells itself could be many different types of cancers. It could be a hepatocellular carcinoma. It could be a cholangiocarcinoma. Rarely, it could be in children. There is something called a hepatoblastoma, which happens in children. And there could be many other sarcomas and many other type of liver cancers that can happen. Now, you asked me early symptoms. That's more. That's a more nuanced question, because liver is a very large organ. It's one of the largest organs in the body, and it has got a lot of functions. So usually what happens is, you yourself mentioned that, liver cancer happens because of infections like hepatitis B and hepatitis C, and alcohol related damage. And what we don't know is lifestyle. These days there is a lot of diabetes, and there is a lot of cholesterols and dyslipidemias, right? Now these sort of diseases, what we call lifestyle diseases, these diseases also cause damage to the liver, and these damages generally lead to what is the common type, the hepatocellular carcinoma. So, in an HCC, what happens is, most of these patients have got symptoms of liver damage, what we call a cirrhosis liver or a damaged liver issues, long before they develop a cancer. So, they are already symptomatic for liver with things like jaundice, fluid in the abdomen, loss of appetite, early, satiety. That is, you eat food, you feel hungry, but by the time you've taken, 2 or 3 spoons, you feel, you can't eat more. That is called early satiety. These are common symptoms. And these symptoms are usually due to liver dysfunction, and they're not specific to cancer. So other types of liver cancer also can cause these symptoms once enough liver is damaged and enough liver becomes non-functional. So most of the symptoms are basically due to liver damage, rather than, a tumor itself. Rarely, of course, when the tumor becomes very big, it expands, it can cause the liver capsule to stretch and cause pain in the upper right part of the abdomen, and sometimes in the right shoulder. A right shoulder pain could be seen in very large liver tumors. So the symptoms are not specific. The symptoms are more to do with liver damage than with liver cancer. But of course, pain in very late stages, pain going to the right shoulder can happen, especially in late stages. Jaundice, fluid in the abdomen, these are the common symptoms that we look out. Digestion issues, loss of appetite, poor appetite, early satiety, these are the symptoms that we see with liver damage.
Okay. Thank you so much, sir, for a big clear picture for explanation of cancer cells, how they develop in liver, and some factors that cause liver cancer. Sir, as you were mentioning about hepatitis B, C, and fatty liver, sir, my next question is that what proactive steps can an individual take in a much earlier stage of life to protect one from liver health disease?
This is, I think, the most important question that you asked, and most important thing that the public must be aware of. The first aspect is that um, liver health begins with vaccinations. Every child now should be vaccinated for hepatitis B. This is now mandatory, but many of us, like for example, I am above 50. Hepatitis B vaccination was not mandatory vaccination in India when I was a child. For the last 10 to 15 years, the government of India vaccinates every child for hepatitis B, but it was not when we were children. So people who are not vaccinated should get vaccinated even if they are older. Prevention of hepatitis B infection prevents damage to the liver due to hepatitis B infection, ultimately prevents cirrhosis of the liver or liver damage, and can prevent a lot of hepatitis B associated liver cancer, hepatocellular carcinoma. The second thing is lifestyle. Um, Hepatitis B and hepatitis C are infections that are are communicable. Especially they are okay, they could be communicable through sexual transmission. They could be communicable through unsafe blood transfusion, needle sharing, and such. So I think the lifestyle and knowledge among people, regarding this can prevent hepatitis C and hepatitis B transmissions. More importantly, in our country, alcohol. Now, alcohol is a very, very highly prevalent, damaging substance that people use. Alcohol causes liver damage. Liver damage, when it's long standing, can result in hepatocellular carcinoma. So, alcohol, either complete abstinence or in moderation, very, very low levels. That is important. Now, beyond all this, a lot of people do develop HCCs, and that nowadays is supposed to be because of fatty liver disease, what is called NAFLD, that is non alcoholic fatty liver disease, which used to be called NASH before, non alcoholic steatohepatitis. Now it's called NAFLD. How do we prevent NAFLD? This is a lifestyle disease. We should cut down our carbohydrates, cut down our sugars, cut down the high fat intake in our diet, make sure that we are exercising regularly, which means that we have at least 40 minutes of moderate amount of walking at least 5 days a week, or at least 4 days a week, or 20 minutes of jogging or vigorous exercise at least 4 days a week. This will prevent a lot of liver damage and a lot of fatty deposition in the liver. Cutting down on carbohydrates, especially sugars. There is a hidden sugar in everything. You have a Coke, you have cereals, you have so many of the packaged food. Everything is loaded with sugars, everything is loaded with trans fats. These dietary substances are all handled by the liver. They get deposited in the liver and cause liver damage and can ultimately lead to hepatocellular carcinoma. So prevention is by using these taking these things in moderation: sugars, cholesterols, packaged foods, processed foods, all that in moderation. And proactively, we can exercise every day and make sure that our liver health is good. Avoiding alcohol, vaccinating yourself, avoiding high risk behavior, sexual transmission, these things can also prevent liver damage and prevent hepatocellular carcinomas.
Thank you, sir, for highlighting such practical tips. And I agree with you that small lifestyle choices can make us live our liver health better. So, sir, as
Yes,
a
20
medical
minutes. I
oncologist,
think we can have 20 minutes. We all can walk or jog for 20 minutes at least 4 times a week. That is a easy thing to do. Vaccinations are easy thing to do. I think
definitely
alcohol, maybe we should avoid. These are all
avoid.
simple things. We can definitely improve liver health and decrease liver cancer.
Correct. So, sir, as a medical oncologist, you must have seen many cases throughout. So, I would like to ask, what is the prevalence of liver cancer in India? Are there any specific demographic or some specific age related to that?
Liver cancer is one of the rarer cancers in India. It's not a very common cancer. It comes around the ninth or tenth common cancer in India. It's not very common. And age wise, these are cancers that happen in older patients, that is above 65 most commonly, because that is a time when there is uh, damage to the liver due to either the viral infections or due to alcohol or due to long standing diabetes and long standing dyslipidemias. So this is a cancer of the elderly rather than younger patients.
Sure, sir. Thank you for answering that. So, sir, talking about treatment of liver cancer. So, nowadays in India, treatment is evolving very rapidly, and we have heard of some new technologies coming in oncology as well. So, could you highlight some innovations or breakthroughs that are available for liver cancer patients?
So liver cancer overview of treatment would be that if it's an early tumor, operable tumor, we always prefer to operate and remove the tumor if it's early. But such tumors are rare because liver being a large organ, we rarely get these. And only around 20% of liver cancers we get in early stage. 80% of liver cancers are not in India, at least not in a stage where we can operate them. So hardly a few go for surgery. The other thing is some early tumors we can also do a liver transplantation. So that is these are the mainstays of treatment for early tumors. But many of the tumors are not resectable. We can't transplant them. In this situation, we do what is called the liver directed therapy. In liver directed therapy, there are many forms of treatment. One is the radio frequency ablation. You can put in needles into the tumor and pass radio frequencies through the tumor and ablate the tumor. Or you could do a microwave ablation. Similarly, you can pass a needle into the tumor and send microwaves into the tumor and destroy the tumor. But these can be done only for smaller tumors, tumors that are less than 3 centimeters or maximum up to 4 or 5 centimeters, not beyond that. The next method of treating, you could give what is called the radiation to the liver, what is called the SBRT to the liver. That is another modality that is now gaining a lot of popularity. We can do that. There are modalities called trans-arterial chemoembolization, where you can uh, put in a catheter into the blood vessel that is supplying the liver tumor and inject the chemotherapy into the tumor. So that's called trans-arterial chemoembolization. You can also inject radioactive substances or radioactive glass beads. Similarly, you can put a catheter into the hepatic artery, which is the artery that supplies the liver, and you can push in radioactive beads or radioactive substances. These radioactive substances will go and kill the liver cells. That is called TARE, trans-arterial radioembolization. These are all modalities which we use. Regarding the medical treatment, chemotherapy generally does not work in liver cancer. Unlike other cancer, the hepatocellular carcinomas, they don't respond to chemotherapy. In liver, I told you that there are other cancers like cholangiocarcinoma. Cholangiocarcinoma, chemotherapy works very well. But in hepatocellular carcinoma, it does not work. So we need to know whether this is a cholangiocarcinoma or this is a hepatocellular carcinoma. Now, in cholangio, we would give the chemotherapy. In hepatocellular carcinomas, we can use what is called immunotherapy. Immunotherapy means you're giving drugs which will stimulate your own immunity, your body's innate capacity. I don't know if you remember during my first question answer, I had said the immunity is very important.
Hmm.
We have immunity that clears the abnormal cells. I think you will remember that. Now we can use our own immune cells we can activate our immune cells with certain drugs, immunotherapeutic drugs, and these drugs, this activated immunity or activated T cells will go and control our cancer cells. This is the latest in liver cancer. So we have many immunotherapeutic drugs called atezolizumab, tremelimumab, durvalumab, ipilimumab, nivolumab, and these are all drugs that activate our immunity and control our cancer. In addition, we have certain tablets called TKIs or tyrosine kinase inhibitors or anti-VEGF or anti-angiogenic TKIs. These tablets also can be used to control the growth of the disease. So we have, a large, it's a gamut of, options. You have large options. So smaller tumors, we operate or we transplant. Slightly larger tumors, we can do a microwave or an RFA. We can do a TACE or a tear, that is injecting radiotherapy or injecting chemotherapy directly into the tumor. And when that is not possible, we can use immunotherapy or we can use TKIs to control. So we have large amount of options.
Thank you so much, Dr. Bharath, for highlighting, various treatment modalities that are available nationwide, sir. Sir, we have often heard that, liver cancer develops silently and diagnosis is a bit late. So, are there any barriers to diagnosis, or that we should know that when one should get a diagnostic test? Like, what can we do for ourselves to know that if you are developing liver cancer or not?
The you I told you this. You are absolutely right. As I told you before, only around 20% of patients come to us in a situation where we can surgically remove and cure the disease. Most of them come with large tumors where we can't surgically remove the
Mhm.
tumor. One thing that we can do is, of course, prevention. I spoke, lifestyle choices and vaccination. One thing we can do is when patients do have hepatitis B and hepatitis C, these patients should be on regular follow up with a hepatologist or a gastroenterologist. And a regular follow up should include ultrasounds and CT scans and tumor markers called alpha fetoprotein, etc., to make sure that these damaged liver, when they develop liver cancer, it is picked up very, very early, and we can, sort of surgically remove it. So good follow up for patients who have damaged liver. This could be due to hepatitis C, hepatitis B, or it could be due to alcohol, or rarely it could be because of uncontrolled diabetes and cholesterols. If these patients have damaged livers, be on good follow up, and a 3 monthly to 6 monthly follow up with proper scans, we can definitely pick up early tumors and address them. In our country, I think this follow up, people don't like coming to the hospitals even when they have problems. So that's why we miss out on early diagnosis.
Thank you, sir. I agree. Follow up care is also necessary if someone is going through any disease. Sir, moving onwards, and beyond the medical side, cancer affects families emotionally as well as mentally. So, in your opinion, can patient and their families, receive the right emotional and psychological support during the treatment and recovery?
Definitely. You missed out on one thing: psychologically, mentally, everything. Other than that, financially. In India,
Yeah, definitely.
unfortunately, cancer is one disease that can actually financially, make a family bankrupt. One cancer can actually bankrupt, especially if it's a earning member, young earning member. Getting a cancer can be devastating for the family, so financially. So there are definitely many NGOs, many social service organization. The Indian Cancer Society, of course, has been around for long. They do help cancer patients. In addition, every hospital, every institution in India, we have support groups where patients themselves form groups to emotionally support each other, to share their experiences, help each other through their journey with cancer. And sometimes we see young children coming and encouraging older people, saying that in Tamil we say tata pati or whatever, uncle, mama, and they will say, aya, I look at me, I am all right, I've taken the treatment, you're so old, you should not be so upset. And so they themselves form a wonderful bond with each other and help out. And other than that, in for example, I practice at a gem cancer center in Coimbatore. We have a gem cancer center support group, Gen support group. So these support groups help each other. In Coimbatore itself, there is a NGO called the can Coimbatore Cancer Foundation, the CCF, which independently runs and helps patients both socially, psychologically, counseling, and of course financially also. So they all, in almost every city, town in India, I think this sort of support is available.
Thank you, sir. I think it is a teamwork. It involves everyone, doctor, family, friends, and community support as
Absolutely.
well. Sir, before we conclude, we will have a quick myth versus fact segment where we'll ask some myth and you have to clarify is it a myth or a fact. Sir, first
Rapid
would be
fire.
that liver cancer. So, sir, first would be that liver cancer develops suddenly and it cannot be predicted. So, is it true?
Um, Mostly false. Hepatocellular carcinoma usually happens in a background of hepatitis B, hepatitis C, alcohol related liver disease, or an NAFLD, that is diabetes related disease. And so, a, a good sort of follow up in these patients, we may pick up these cancers early. Of course, there will be a small segment where we can't pick it up.
So, second notion is that liver cancer patients have poor chances of survival regardless of treatment.
This is the same for every cancer. Early cancers do have a good chance of cure, especially with a resection transplant or liver directed therapies. Unfortunately, it is true for the late cancers. We may not be able to cure them, but with the current immunotherapeutic drugs and the current drugs like lenvatinib and other TKIs that have come, we can prolong their life by maybe a year, 2 years, or sometimes even longer.
Thank you so much, Dr. Bharath, for bursting out these myths with clinical and medical knowledge. Sir, at last, any golden tip that you would like to give us and our viewers that we should follow for good liver health?
Vaccinate for hepatitis B, avoid alcohol, cut down or avoid sugars and carbohydrates, reduce fats, exercise for at least half an hour every day.
Correct. Thank you so much, Dr. Bharat, for giving us, your valuable time and your insightful knowledge about liver health. Thank you so much, sir.
Thank you so much. It was nice talking to you.
See.